Power 98 WPEG. Welcome to Power98FM.com. It's No Limit Larry from No Limit Larry in the Morning Maddhouse. Got my lovely co-host with me,
Miss Jessica, the girl next door. How you doing, Charlotte, America?
Charlotte, America, welcome. And we're trying to get everybody out there covered. That's right, get covered. Mm-hmm. And we brought the lady to get everybody covered, Secretary Sylvia Burwell.
Thank you so
From
much.
the White House, the real White House.
The real White House.
I just had to say that.
We
I'm
gotta
sorry.
act like
Mama made it. Mama made it.
act like we got some sense today.
Okay.
All right. Get serious.
Straighten my tie out. All right. So, Secretary Burwell, what is the first step in getting covered?
So first, I just want to say thank you all for having me.
Oh, anytime.
This is the place to be, and I know that. So thank you all for having me. So the first thing is that people should know is there's an important deadline coming up, and that is December the 15th. So
Okay.
if you want coverage, you should get signed up by December 15th. So your coverage starts January 1st. Start that year right.
Okay.
Start with your coverage. Start with taking care of yourself on January 1st. First step is folks should know it's affordable. You can find a plan. The people in the marketplace right now can find a plan for $75 or less in terms of their premiums a month with that tax credit, with the help they get. They get financial help. Second thing they need to know is it's simple and easy to do.
Mm-hmm.
We've worked, consumer said, hard to enter a 14-digit number, fixed it.
Fixed it.
Consumer said, hard to get your password reset, fixed it. And so consumer said, we need to understand how much things cost. Created something, a feature called the total out-of-pocket cost estimator to help people understand what's this going to cost me for the year. So simpler and easier, and the last thing is you can get help. And this is the how you do it part.
This is the how you do it part. Listen.
You can go to healthcare.gov, faster, and all those things we've changed. Just do it online if that's the way you want to do it. But a lot of people want in-person assistance either by the phone or in person. And you can do that two different ways. If you want to do it by phone, 1-800-318-2596. Just call
Got to say it one more time. 1-800
1-800-318
318
2596.
96.
Or you can go to a place called localhelp.healthcare.gov, enter in your zip code, and you can find a place where they can see you face to face. You make an appointment and they go see. And here in Charlotte today, I'm going to go visit, and I think you're coming with me.
I'm coming with you.
You're coming with me.
If she says you gotta go, you gotta go.
Listen, I'm coming.
The man is with me.
I'm coming.
And we are going to a site where you can do it in person.
Oh, wow.
You can do it in person, and there's another place. We've opened what we call a storefront so that people can go and enroll in person, but you and I are going to a place where you can enroll in person today.
So let me ask you this, Secretary Burwell. What are some of the mistakes that people make when they're trying to enroll in healthcare? What is some of the mistakes
some of the
they
things
make?
people need to do is go ahead and figure out the things you need. You need some information, like you need your social security number. You need to know your income because that's how they determine your financial assistance.
Okay.
You need to know if you have coverage any other way. And then you should think a little bit about what's my situation. Do I have 3 children and I know one of the kids is going to need braces next year?
Right.
What kind of situation you have? Think about those things so it'll be faster and easier. The other thing that people should just think about is, where do I want to take my risk? And that has to do with what you pay and when. Would I rather have a little bit higher premium and a lower deductible, or would I rather have it the other way? But that's what those assisters are about, to help people talk that through. Which way, if I think this about my life and what I want to do, this is the way I should do it. But the main thing is to know as you come in that it is affordable. Many people don't know that they get that financial assistance. In the marketplace right now, 8 out of 10 folks get the tax credit.
That's great.
8 out of 10 folks
That's great.
get that financial help that can help this be affordable. The other thing I will say is it's important to understand that in the silver plans, you can get help with your co-pays and things. And many people focus on that tax credit for premiums, but you can get help with your co-pays too. So when you go back in, your out-of-pocket costs, you can get some help with that too.
So I hear you talking about the marketplace a lot. Can you talk a little bit about exactly what that is?
So the marketplace is basically, it is a website where you can shop. And you can shop.
Online shopping, hey.
Online. That is what this is. It's the perfect time of year to know about this. Which it is, where you can go and you can shop to find a plan that works for you. So you normally in insurance you have to go and you have to find an insurance company and call them up and ask this one and call them up and ask that one. Instead, what you can do is you just go on, you enter your information, and you see
They
how
come
many
to you.
plans.
They kind of like come to you.
You will see.
Okay.
Here's how many plans that I can look at and then you can shop and compare.
Okay.
And there's actually even a feature called window shopping.
Y'all like window shopping?
Hey.
Y'all like window shopping?
If you don't want to enter everything in, you can go. It's a feature that we have called window shopping, and you can just go without entering and applying and everything. But what you do is, you might want to window shop a little bit, get a sense of things, then go in, enter your information, and you get an email that says you are eligible for.
Oh, wow.
It tells you.
So it tells you.
It tells you, and it also tells you how much financial assistance you're eligible for.
Oh, wow.
And then you use that to pick a plan.
Okay.
So it's like informed shopping. You can
Okay.
start by just like, let me check out. This is what the coverage would be, and that does help you with understanding your financial.
Secretary, let me ask you this for some of the folks out there who procrastinate and they might miss this December deadline. What do I do then?
Well, if you miss the December deadline, you do have till January 31st, but your
Okay.
coverage won't start until later. And we want to encourage everybody in. The other thing about those procrastinators you just mentioned,
Yeah.
I would just encourage folks to get on in now, because right up against the 15th, I will tell you what, because there are a lot of procrastinators, numbers go up, and you might have to wait a little longer. So we encourage everybody, come on in now. And we're seeing that actually in our numbers. We're seeing everybody start to come in now,
Yeah.
But that is a good thing. So
That's
ahead
great.
and get on in. Don't wait till the 14th or the day of the 15th. Go on, get on in this weekend.
Now, what's the average time that it takes to complete the process?
So in terms of the application itself, like here's my information to determine your eligibility, to say here's what you're eligible for, here's how much money. Average time last year was 10 minutes.
Okay.
What takes longer is the shopping. And I'm sure you're not surprised by that.
Yeah. It takes
with
us,
you women.
gives us
Yeah.
a little bit of time, you know.
Choice.
Yeah.
Because people want to make the right choice. And making that right choice is important, because get that coverage and use it. What we want people to do is get the coverage and use it. So get the coverage that works for you, both in terms of your finances and what you need. And the other thing about this coverage is, as soon as you get it, as soon as you get your coverage, there are a bunch of free services that don't have to do, in terms of preventative care, wellness visits, cancer screenings, flu shots. I hope everybody's gotten their flu shot. If you haven't gotten your flu shot, you need to work on that.
I'm just naturally, healthy. I'm good.
Let's have a little boost. Exactly.
I didn't give it a clue. I gotta give it a clue.
I know, Larry, you need a boost. That's what people do. So, but all those kinds of things you can get right away. But the shopping takes a little bit because people want to pick the right plans, because it's your choice for a year.
So let me ask you this: if I go to the marketplace and I go on the website and I go to the marketplace, is there coverage available for the whole family? So
Absolutely.
Okay.
Absolutely. You can enter in, and you enter in all the information. Have met lots of folks who've had coverage for their family for the first time. A lot of folks who work but don't have coverage through their work.
Right.
Two people are working in different situations. In Texas recently, I met a fella who works but is in graduate school, and his wife works at a nail salon, and they didn't have coverage, and they had a child. And then had another child. So you can get the family on, and that's where you just enter that information. How many kids, ages, that information. But when you ask what to bring the kids' information too. You need their names and social
One more
security.
time with the website and the phone number, so we can get them covered here in North Carolina.
Healthcare.gov is the website, so that's simple and easy. The phone number is 1-800
1-800
318
318
2596.
96.
Now, before you get out of here, you do know our Carolina Panthers are having an awesome
year.
Awesome year.
Before we get to that though,
Undefeated.
yeah, undefeated. But before we get to that, let me say this: there is a challenge out there.
Oh,
and
yes.
tell them about the challenge.
There is a challenge.
The challenge. We gotta win, Charlotte.
Yes.
Charlotte, we gotta win the challenge.
The challenge is, President himself
The president.
said we are going to have challenge communities. We are challenged, and Charlotte is one of the places that is competing to be the best this year. Charlotte, in open enrollment. So everybody get on in and help Charlotte win, because whoever does win,
What happens when we win?
first of all,
what's gonna
you
happen
get
when
the
we win?
pride of more health care for your people
Yep,
and everybody
yep,
else,
yep,
and all
yep.
that means. But second of all, President will be coming.
The president coming to
president
visit.
is
I think
coming
I'm gonna
to
cry.
Charlotte.
Mama, we won. We did it. We did it, Mama.
The president is coming.
The president is coming.
Because everybody's going to sign up, because they listen. And Jessica. And that's what's really going to happen here. And I'm quite certain about that.
Ladies and gentlemen, Secretary Burwell, but we wanted to talk about the Carolina Panthers.
We
12
got to, since we have her here.
Oh, you gonna make her do that?
We got to.
You gonna make her do that?
We have to.
This is gonna go viral.
we have
This
to.
is gonna be viral. You gonna teach her how to do it?
Cam
I know what you're gonna do.
Yep.
I'm
is
gonna watch.
famous
Yep.
after he touchdown or whatever.
Yeah.
In addition to him giving the ball to the kids
Yeah.
and things
Yeah.
like that,
This is
he is famous for the dab.
For the dab.
Are you familiar with the dab?
I got to be familiar. Give it
So
to
the
me.
dab-
Give it to me.
Show her the dab. Jesse, show her the dab.
Dab. That's it. Just that. Just you fold your arm, hold your other one. Dab.
I
Dab.
think I got
That's it.
Oh, we got the secretary dab, baby. You won't see this nowhere. You won't see it nowhere. You know what?
1, 2, 3.
Dab. Get covered right now, North Carolina. Sign up.